I'm Vonetta Dotson. I'm the founder and president of CerebroFit and a professor at Georgia State University. There are lots of resources out there for people who have financial barriers to receiving therapy. One option is to look for resources through the National Alliance of Mental Illness. It's a national organization that has local chapters, including one in Georgia. They actually just recently launched a free app that provides free counseling services. So you can find that on their website. There are also resources through the National Institute of Mental Health and the American Psychological Association. I'd also mention that a lot of providers, a lot of therapists provide really discounted or even free therapy services as part of their practice. A lot of people have what's called a sliding fee scale, where they charge the cost based on your income. And so you can sometimes get therapy sessions for as little as $10 or $12 per session. In addition, some providers have pro bono cases, and so they will have a certain number of clients they'll see every year that they provide for free. So it's always worth asking if you're not sure whether or not that's an option. People use the term mental breakdown to describe when they feel overwhelmed and sometimes have a quick onset of really severe symptoms. But in reality, it's not a diagnosis. It's not something that psychologists or counselors would give as a diagnosis. But what it means is that the person is feeling that they don't have the mental resources to deal with whatever's going on in their life. So in some cases, it could mean that they're having a lot of anxiety, a lot of stress, and they feel like they're at their wits' end and they have no options and they feel like they can't go on, can't function. In some situations, though, it can be a sign of something more significant. So someone might have what they call a mental breakdown that is characterized by more symptoms such as hallucinations or delusions, and that would be more of a psychotic break. And that is a severe mental illness. So in some situations, it could be overwhelming stress. In some situations, it could be a more significant psychological condition. And in either situation, it's important to get help and to find out what the options are for getting treatment so that things can get better. There's a lot we can do to try to either prevent or stop episodes of psychological distress by giving ourselves a break from the stressors of life, building into our day time to relax, to meditate, to exercise, to do things that just give our mind a break from all of the other obligations that we have. That can be really powerful in preventing that buildup of distress that can lead to what people would call a breakdown. Once those symptoms start, there's things that you can do to try to recover from that sooner. So that can be things like seeing a therapist, but it can also be something like talking to friends and family. The power of venting and being able to share that with someone can be really helpful. It also can be helpful to practice things like meditation and relaxation techniques. So people can spend anywhere from 5 or 10 minutes just really focusing on their breathing, trying to calm down their mind and their body, and that can have a powerful effect on minimizing some of the psychological distress that they're feeling. When people say they're struggling with mental health, that normally means that they have some psychological symptoms, such as depression or anxiety, that they're having a hard time coping with. So instead of having something that's more transient, meaning that it comes on for a few weeks and then it gets better, it can linger and last for months or even years sometimes. And so in those situations, we might say someone is struggling with mental health. And that means that that's a sign that something needs to be done, that some sort of treatment should be sought. There are a number of warning signs, but there's two main ones that we look for. So one is if the symptoms that someone's experiencing is causing distress. So that means if you're feeling sad, if you're feeling anxious, if you're feeling overwhelmed. Are you feeling really bothered and disturbed by them? Are you finding that you're not comfortable with how things are going for you at that point? That's a big sign that you should probably talk to someone to try to see what you can do. The second thing we look for is impairment. So are the symptoms that you're experiencing, whether it be depression, anxiety, or other psychological symptoms, are they causing problems or interfering with your ability to do your job, to take care of family obligations, to just do the things that you need to do in daily life? So impairment is when your life is being affected by those symptoms. So if you have either that distress or you have impairment in some of your functioning, that would be another big sign that there is possibly a mental illness going on. So mental illness can be triggered from the environment or from our bodies. So we think about two kind of main categories. So in terms of our bodies, we can have genetics that put us at risk for mental health problems. We can have medical conditions that can also cause mental health problems. From the environment, we think about stressors and trauma and things that happen throughout our lives can trigger mental illness as well. And then you might wonder, well, why am I having these problems now? But you've been carrying that throughout your life, and then it starts to manifest at some point. So either way, whether it comes from an environmental stressor or trauma, or if it really is a genetic or medical trigger, ultimately our brain is affected whenever we have mental illness. So brain health and mental health are the same thing. When you have mental illness, that means that something is not going right in your brain. It is a physical problem just like any other medical condition that you have. And so that means that that treatment is going to be necessary the same way that if you had arthritis or diabetes or any other physical condition, you would get that treatment to try to make things better. So as I mentioned, mental health is brain health. That means when you're having mental illness, there's something happening in the brain. And there's things that we can do in terms of our behaviors that can help us have a healthier brain. That's what my company CerebroFit focuses on. We offer services in one place that can help you promote a healthy brain based on what science tells us. These are things like staying physically active, eating well, sleeping well, and getting treatment for mental health problems. If you're experiencing a time of crisis or fear you might harm yourself, then call 911. If you're experiencing other symptoms that are longer term in nature and you want to get help, then talk to your doctor and ask for a referral to a mental health professional. Thank you for watching this video. I hope you find it useful. And if you did, then forward it to someone else who would also find it useful. Follow this channel for more information on health and wellness.